Large businesses now have an extra year to offer health insurance to their employees. But is 50 employees really a large business? News 13's Evan Donovan asked some local businesses whether this delay will help them comply with that law. And what are these companies saying, Evan?
Well, some are relieved that the delay will give, are saying that it's just delaying the inevitable. John Taylor is exactly how you'd picture an adult who owns a toy store.
The eye holes are a little far apart.
When it comes to the requirements of the Affordable Care Act,
Came down to it and they said, listen, doesn't matter how many employees you got, you're going to have to provide full health care insurance for all your employees, then I'll just close.
Taylor's new business, an indoor soccer arena in Brevard, will be his 6th retail shop between Western North Carolina and the Upstate. He says it's a simple matter of economics.
I'm not a selfish guy. I mean, I don't want to keep it all for myself, but there isn't any extra.
Yesterday's extension gave large businesses, defined as 50 or more employees, an extra year to offer a qualified health care plan to employees. Taylor has just over 50 workers.
Just get rid of 8 of them. Which might mean closing one of my businesses.
But please understand that your part-time employees' hours are going to count towards your full-time equivalents.
Chris Gant Sorensen is an attorney who represents companies on complying with the Affordable Care Act.
Large employer is not an employer that has 50 employees or even 100 employees. I would say at a minimum, a large employer should be defined as 101 employees or more, and preferably 200.
According to census data, about 1/3 of the American workforce is employed by companies with fewer than 100 employees, and 96% of them already offer qualifying health care. Small businesses like Taylor's will be glad to use the extra year extension.
For any size business, for all employers, the administration's decision yesterday to push the employer mandate from January 1, 2014 to January 1, 2015 is good for them all.
I spoke to a number of other local businesses today, including some restaurant groups, an industry that typically does not offer health insurance. They say they're glad to have the extra year as well, but they still don't know what it will mean for their business.